Okay, good day to you. We will discuss now the gastrointestinal tract disorders. The gastrointestinal tract is present inside the abdomen, and the abdominal cavity is very huge. So we use two ways to divide the abdominal cavity. The first way is into four quadrants. We divide the abdominal cavity into four quadrants by two lines, a vertical and a horizontal line, both lines passing through the umbilicus. So we have a right upper quadrant, left upper quadrant, right lower quadrant, and a left lower quadrant. This simplifies things. For example, if we ask a question, where's the liver and the gallbladder? The answer is in the right upper quadrant, A. Where's the appendix? The answer is C, right lower quadrant. Where is the sigmoid colon? The answer is D, in the left lower quadrant. So this is how it facilitates locating the site of the problem. If you know the anatomy of the internal organs, and if there's a pain coming from one of the four quadrants, we can think of the anatomical structures present in this quadrant and try to think out the differential diagnosis. Another way to divide the abdomen is to divide the abdomen into 9 regions by two vertical lines and two horizontal lines. The two vertical lines are from the mid-clavicular point to the midpoint between the anterior superior iliac spine and the symphysis pubis below at the upper thigh. And the two horizontal lines, the upper one is the subcostal line through the lowest point of the costal margin made by the costal cartilage of the 10th rib, and it coincides with the level of the 3rd lumbar vertebra. And the lower horizontal line is the intertubercular or transtubercular line, which passes between the two tubercles of the iliac crest at the level of the 5th lumbar vertebra. Locations of some of the abdominal organs: stomach is in the epigastric region, the transverse colon in the umbilical region, and the liver in the right hypochondriac and epigastric regions. So if we ask, where's the liver and the gallbladder? The answer is in number 1. Where is the stomach? The answer is in number 2. Where is the appendix? The answer is in number 7, the right lower iliac region. Where's the sigmoid colon? The answer is in the left iliac region. Number 9. Where's the right kidney? The answer is in the right lumbar region, number 4. Where's the urinary bladder? The answer is in the pubic or hypogastric region. This is number 8. So by dividing the abdomen into the 9 regions by the two vertical lines and two horizontal lines, and by knowing the anatomy of the abdominal organs, this can facilitate the location or reaching a diagnosis about the cause of the patient's complaint. Relevant points in the history. First, we ask about general symptoms like lethargy, anemia, weight loss, and the appetite. And in anemia, we ask about the manifestations of anemia, like lack of concentration, like dizziness, and so on. We ask about dyspepsia and reflux, dysphagia, vomiting and hematemesis, peptic ulcer, whether current or in the past, inflammatory bowel disease, history of gastrointestinal surgery, pancreatic disease, congenital disorders, hematemesis and hemoptysis, and we have a table comparing between them. Hematemesis, of course, is vomiting blood, while hemoptysis is coughing blood. First point, in hematemesis, the color of the blood is dark red or brown because it is digested blood. In hemoptysis, it is bright red. The quantity of the bleeding in hematemesis, it's in large quantities in clumps, while in hemoptysis, it is foamy or runny. In hematemesis, it's mixed with food. In hemoptysis, it's mixed with mucus. The reaction is acidic in hematemesis, alkaline in hemoptysis. Associated symptoms. They are all related to the digestive system, to the gastrointestinal tract, like stomach ache, abdominal discomfort, nausea, retching. In hemoptysis, there is chest pain, warmth or gurgling over the chest, persistent cough, and sputum. The main causes of hematemesis are esophageal varices and peptic ulcer, while the main causes of hemoptysis are chest infection and cancer. And if we look at this question, chest infection can lead to, of course the answer is hemoptysis. Peptic ulcer. Peptic ulcer affects 10% of the world population, and the incidence in men is twice as in women. It can affect the lower esophagus, stomach, or the duodenum. What matters is a current or a past history of peptic ulcer, particularly when non-steroidal anti-inflammatory drugs are being considered. Helicobacter pylori organism, which is a gram-negative bacterium, can be identified in 90% of duodenal ulcers and in 60% of gastric ulcers. Treatment of peptic ulcer is not surgical. Since the advent of effective drug therapy, triple therapy regimens are used when Helicobacter pylori infection is involved. Example, using a proton pump inhibitors such as omeprazole, a broad-spectrum antibiotic such as amoxicillin, and metronidazole. In peptic ulcer, aspirin and anti-inflammatory and non-steroidal anti-inflammatory drugs are not given with a current or a past history of peptic ulcer for fear of perforation leading to severe internal hemorrhage.